weight and becoming very, 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 very tired. It was my mum pointed out to me. I was had just got married, and my husband and I were trying to have a baby. So all the tiredness that then came upon me, and the running to the loo, and the terrible thirst, well, I put down to being trying to get pregnant and being pregnant, which I discovered I was. So when I discovered I was pregnant, through the doctor, she dipped my urine and then said, "Oh my goodness, there's a lot of sugar in your urine." So I thought that too was part and parcel of being pregnant. I didn't know any different. And she did a glucose tolerance test in her surgery the following day, and I was in the Royal Victoria Hospital that afternoon with blood sugars of 38. Um, and felt rubbish. That was a Wednesday. Felt rubbish Wednesday and Thursday. Had my first insulin injection on the Friday, and by Friday tea time, felt like I could run a marathon. It was so instantaneous, unbelievable. Um, didn't really know I felt sick till I started to feel better. Do you know what I mean? It was a bit like that. Um, so then it was insulin all the way from then. I was on multiple daily injections for many, many, many years, and the last 9 years I've been using an insulin pump, which is fantastic. And I carb count, so I just I count everything, like absolutely to the gram if I can. It's a bit of a obsession.
So, when going back to that time then, so what was your knowledge? Was there anybody in the family have diabetes, or did you?
My dad's oldest brother was diagnosed with diabetic when he was 3. So you can imagine my dad's now 80. All those years ago, he had one insulin injection needle that he boiled in a thing of water, or his mum did for him. He's the only family member that we knew of, and he was very, very ill at that time. He had gone blind, and he only had one kidney, and ultimately it was complications from diabetes that he passed away from. Um, but it's quite funny because since I was diagnosed, that uncle who passed away, not his children, but he has 2 girls. All their children have been diagnosed with type 1, and there's 4 of them. Um, and there's nobody else in my close family at all. In a way, it sounds strange, but in a way, I was glad that it was just type 1 diabetes. And I don't mean to belittle it at all, but it was something that we knew an awful lot about here. And from 30 years ago, we know an awful lot more about it now. But I was glad it was nothing that I felt was life threatening, because I didn't see diabetes then as something that would kill me or anything. I just thought of it as something I had to deal with on a daily basis and adjust some things that I was doing and take a few injections, and all would be right as rain. I didn't really expect ever to have any complications or um, anything like that. I just kind of thought, oh, that's okay. I can deal with type 1. I'll tell, and I tell everybody that I have it if I meet them, because I don't try and hide it away, which I have some friends who are type 1 who would barely tell anybody. So that's how I handled it at the time. It was a bit scary being taught how to inject yourself, but it wasn't nothing at that time challenged me. My challenges in relation to it have come a bit later on.
And we'll come to that there, Wendy. Just want to go to Tino. So Tino, same question to you then. So when were you diagnosed? How were you diagnosed? What was the situation at the time?
Oh, thank you for having me again to respond. So, anyways, it was during the Christmas holidays, like in December. That was in 2010, and I was actually 13 years old. So then I was actually at our farm in the rural areas. Like everybody was just focusing on the work that they're doing, people are doing projects and stuff like that. So of course, everybody would have to be doing some shows to make sure that you're contributing much to what everybody else is doing at work, at home. So people thought maybe this guy, he just doesn't want to do work. He just wants to chill. He's now being stubborn and stuff like that. Because of course I was having fluctuations on my blood sugars, because of course nobody knew what it was then. So the fluctuations in my mood, the behavior, it was worrisome to my family. And then this other day when we were just having family time, just talking, like I think that was on Christmas. when everybody was just eating, I didn't want to eat. I was just irritated. I didn't want to talk. I was feeling tired. The sleeping patterns were so rough. Like, of course, I was visiting the toilet more frequently, stuff like that. So people there said, wow, let's just take him to the clinic. I think there's something wrong with him because I was losing weight. That's what gave an alarm to the family because I was losing so much weight, but they didn't know what was going on because I never had any other sickness that they knew, like headaches, AC, like stomachache. Those are the things that they say, okay, if he's having this, he might be sick. So when I go to the clinic, the rural clinic, the guy that we met over there, he just said, I think this guy, he might be diabetic, which he said in a native name, like that we have in Zimbabwe, but nobody knew what it was anyway. Nobody was puzzled or like with the mention of diabetes. So then he said, I think you should take him to a general clinic, to a general hospital. And we took about a week after and then we went I was taken to the urban, which is in the capital where we get proper healthcare. So when I went there, firstly, I had to go to, what do you call this, to a private doctor. And then I was put on drips when he said, I was tested like the ketone and then it was positive. I had ketone, like they were so positive. The urine was very, very acidic. So he said, this guy he's diabetic. So I was put on several drips, I think maybe more than 5 on a single day. And then, of course, I was taken back home because it was it was so expensive. I couldn't be kept like for a long time over there. And then, of course, I went home. I was still on the drip. And then he said, you would want to see me the next day, stuff like that. It happened. And then a week after, things got worse. And then the family decided maybe we take him to a government hospital. Maybe they might have something to give to him. So then it took about a week until they had find a proper dosage for me because they kept on changing and stuff, being given pills, being given insulin and stuff like that. And up until they got to the point when they said, I think this one would work better on him. So, but it was something else really. But then, of course, I was a little child, so I didn't have much. I wasn't even concerned, but my family were just saying, I think he should just take his insulin as was instructed. He should went on up until I realized that I have to step up and study so that I know how I can manage myself. But then, since then, I have never been back to the hospital because of poor management of diabetes. But then, in the beginning, it was very, very hard for me.
Okay, Tino, that's fantastic. I'm just wondering, it's not that we don't like seeing your picture or your lovely white teeth, but the video, the sound is dropping out. Do you want to switch the camera off just to see if that might make you come through clearer? Don't take this personally, Tino.
Okay, yeah, sure. No, yeah.
It looks like a photograph of your father, Tino, you've just put up. So, so tell me, I mean, to have a week in hospital then on a drip, without actually anybody saying this person might be, this child might be a diabetic, seems like a really, really strange thing. I mean, is that, how common is the knowledge of what diabetes is in Zimbabwe?
Back then we only had a few people knew about what diabetes really is. So like, I think we had about 10 doctors, professional doctors from each and every hospital. So those ones were just called specialists and some were physicians with the best knowledge about what diabetes really is. So everyone was just to be texted to say, he has to see Dr. So and so. So there were only a few people with knowledge. Even up to now, the knowledge is not really like spread out like where people know so much. So what happens right now is the Zimbabwe Diabetic Association, they reach out and go to the hospitals, go to the clinics to spread awareness, to make sure that people know.
Okay, Tino, we lost you. I think we have lost Tino for a minute. Sarah, you better step in here. Sarah, you see, with your life, you know, every day, day by day, what impact, Sarah, does having diabetes mean to you living in Uganda? Or, sorry, you're muted, CR?
Yes, can you hear me now?
We can
Yep.
hear you. Thank you.
Okay. Yeah, I beg your pardon.
You're okay.
I didn't get that quite well.
Right, so question is, so I mean, having diabetes, okay,
Mhm.
you've had it now for what, 14 years or so? So,
Yes.
so I mean, living with diabetes from day to day, well, what are the main problems that you have then living in Uganda?
First of all, I would start with what I started with. That was inadequate information about diabetes. So you go to hospital, they tell you, well, for my case, I went to hospital, I was told I don't even remember if it was specific that I had type 1, but I was told I had diabetes. And then they told me how many injections I had to take, what I didn't have to eat, how much I had to take, and that was it. You know, so there's lack of information. The information out there is inadequate. You have to go out of your way to actually find more information about diabetes, how to cope on a daily basis. You know, you learn along the way, so you're on your own in terms of information. And then we have the drugs. Some of them are unavailable, and those that are available, it's hard to find them in pharmacies sometimes. For example, I stay in Entebbe, so in most cases I have to go into Kampala to actually buy drugs, because the pharmacies in my area, most of them don't have the insulin that I use. They don't have strips that I use. They don't have the right syringes that I need. So I have to go into Kampala to actually purchase those items. And even in Kampala, I have to go to specific pharmacies to purchase the insulin and the test strips. And then we have the expenses. They're really expensive for a Ugandan. You know, we don't have any support from the government, so we have to buy these drugs by ourselves out of our own pockets, and most people can't afford that. At least 90% of people can't afford that, and some people actually they choose to skip insulin doses because, you know, they won't be able to afford the next vial. Some of them go for weeks without testing their glucose, you know, not out of free will, but because the test strips are so expensive for people to afford. So they're literally I would test at least twice a week, and that's enough. But we should be testing as many times as possible. And some people don't do that, you know, and then really the expense is a big burden to most people living with diabetes in terms of medical supplies.
Okay, well, I mean, that's very hard for us living in the United Kingdom to understand, you know, because with our health services, then it's sorry, Ola's just appeared. Hi, Ola. I'm glad you can hear us now. You know, so I mean, with our health service, and we take this so much for granted. So you said something like 90% of people living with diabetes and cannot afford. Is that what you said?
Yeah, at least 80%, 90% of people can't really afford these drugs, you know, and we're talking about vials that go for something like £5, you know, something you would, to someone else, it might look like that's very little, but to some people, that's a lot, you know, £5 for a vial of insulin, and someone can still not afford that. And then the government doesn't have programs or, you know, a support for people to actually get those medical supplies for free. There are a few organizations like Novo Nordisk that have programs for children specifically, but after a certain age, that child is on their own. They're considered as an adult, so they have to buy these drugs out of their own pocket.
Okay, all right, okay.
Yeah.
We're going to come, we'll come round again. So I just want to go to Wendy. So Wendy, living with diabetes, you have a massive help that's got 4 legs, haven't you?
I do. Hold on a minute. Echo, here. Come here. Come here. Quick. In your own time now. Come here. She's actually taking my glucometer out of my handbag and bringing it to me. Would you believe? Here, up here, up here. Come on, up, up. There. She will never perform when you want her to. She's bringing me my glucometer. This is Echo. She's the real star of everything I do. I'm known as Echo's mummy, never as Wendy. Echo's trained to alert me to both low and high blood sugars. I lost my hypo-awareness about 10 or 11 years ago, and had a couple of very near misses in the car and things like that. So I've always been a lover of dogs and had dogs in the family. At the time, I had a very lovely chocolate Labrador who was a little bit too old to train. So I got involved with the charity, and they have trained Echo up to help me. Now she will paw me or bark at me whenever she detects my sugars going low. She's trained to alert me at 5. Now I work in old money, so I'm not sure what that is in the new levels, but I blood sugars of 5 and 12 as a high blood sugar. And she will paw or bark. She would also go to my husband and annoy him if I'm not within her sight, or if he's easier to get to. She will annoy him so he knows to come and get me to check my blood sugars. And she's so in tune with me now. She'll alert me maybe if my sugars are at 8 or 7. And I mentioned this to the dog trainer, and she can actually detect them dropping. I get about 20 minutes before they hit 5 millimoles from her. So she beats my technology, she beats my sensors, she beats my pump bleeping at me. She beats my Libra 2. Her nose beats everything. She's trained to my saliva samples. That's how she was trained. It's her nose. It's her nose that detects my sugars dropping.
Wow.
And she comes everywhere with me. She comes to work. She comes when we go on holiday. She goes in airplanes and trains and buses. And she comes to the theatre, and she comes to the cinema, and she comes to concerts. And she's just at my right hand wherever I go. So
at what age then was Echo then whenever she came into your life then?
She was nearly 2. She was nearly 2. The charity get the dogs when they're little 8-week-old puppies. And even at that age, they've gone through a basic assessment process to assess their potential and suitability for the work. And then the puppies are placed with people who look after them for around about 18 months to 2 years. And these people teach the dogs basic manners, socialization, how to behave in public through a program, an obedience program led by the charity, and regular obedience classes at dog training clubs. And then comes the marrying up process between the dogs that are available and the people who are awaiting a dog. You have to be, it's your clinical need that determines when you get a dog. It's not just Wendy Smith wants a dog, so Wendy Smith gets one. You have to have, fall into you have to meet certain parameters. And the fact that I had absolutely no hypo-awareness was one of the major things that helped me get Echo. So it takes about 2 years to train her, so that she's reliable, and she gets an exam every year, both by her nose. Her nose is tested every year, and I have to record everything, every single blood sugar reading I take. And Sarah had said there about the number of glucose strips you use. I use about 10 or 15 a day. It nearly makes me feel ashamed to a certain extent when there's people can't use one. You just don't realize what I take for granted, what other people don't get. So I have to record everything and all Echo's performances. Sometimes she's not a machine. Sometimes she's lying on the sofa with her legs in the air, sleeping, dreaming about rabbits, and my blood sugars drop and she still dreams about rabbits. But on the whole, she hits it 90-95% of the time. And people have said to me, that's a 10% failure. And I said, yeah, but it's 90% more than I have without her, So she is remarkable.
I mean, that must have been a massive life changer for you then, was it? Then just
completely. Do you know, I before I had her, I would go out in the car, say I went to fill my car with petrol, a 10-minute job, and I met somebody and I got talking and I was there for half an hour. All my family were panicking that I'd had a hypo and crashed the car, that I was collapsed somewhere. Now, as long as Echo's with me, nobody worries. You know, it's taken a big strain. It's lifted a lot of stress that you maybe didn't even realize was there from the family. She's a very lovable dog. So wherever I go, whether I go to hospital appointments, doctor's appointments, wherever I go, Echo makes people smile. You know, I do talks with her. I go to schools and I try to raise the awareness of the Assistance Dogs program, and she just makes people smile. And I often say I'm just on the end of the lead. I tell you, I was off work ill last summer before. I've lost 2020 with COVID. The summer before I had shingles and was off work for a month. And when I went back to work and walked in with Echo, everybody said, "Oh, Echo's back at work. Hello, Echo. Echo's back at work." It took about half an hour before anybody said, "Hello, Wendy, how are you?" So, you know, I've just got used to it. Now I just accept it. It doesn't faze me anymore. And I often get referred to as Echo's mummy. I'm not Wendy, I'm just Echo's mummy, you know.
Okay, can you put Echo on? Let's talk to Echo. No, I'm only joking.
Yeah, you wouldn't see her now, look. She's on the sofa. Hello. Say hello. Come on. She likes the camera. Here, come on up and say hello. Come on up. Yeah, she'll bark if you tell her, look, watch this. Bark. Tell them what you do. Bark. No, not your paw. Big one. Big one. So you see, why is she not performing when I want her to? Bark. Oh, it's not fair, is it? It's not fair making her perform when she doesn't have to, is it?
Is that a cat behind you there, no?
Yes, that's our cat too. Yes, that's Gizmo. Yeah.
Nice.
Yeah.
Uh-oh.
He's sleeping on the sofa.
Okay, but cats are basically useless things anyway, so I mean, we won't talk.
No, you see, can I tell you something? I have to tell you one funny story. Our cat woke me up in the middle of the night one night about 4 years ago, licking my nose. So much my nose was raw in the end, and my blood sugars were 3.1. Now, he's never done it again. He's never done it again, but there you go.
All right, Wendy, and I won't ask you what your husband does. So, and I believe Echo is a film star, is that right?
She is a film star, and yes, she is going to be in a BBC drama that is being put out this year. It was to be called Awakenings. I think it's now called Three Families, and it's about three Northern Ireland families who have gone through problems with associated with abortion. And Echo is the star of the show. She's the dog of the main two characters in the show. So she went away for 3 days filming, and just wooed everybody over. And if any of you watch Line of Duty, she was taken to be in Line of Duty, but unfortunately her one performance in that, which was lying in the bed in the corner of her room, was cut. So she's not even on the screen for that. So that was a bit of a failure, you know.
Okay,
but,
so I mean, can Echo detect then bent coppers?
Yeah, yes, but she kisses them to death. That's the only problem.
Right, we will come back around in a wee minute. Tino, are you back with us, Tino?
Yes, I am. Yes, I am. Oh my God. I don't know what happened. I think it was my network. Apologies.
That's okay. That's good. Tino, can you tell us, you started to talk about insulin for children, didn't you? The program you're involved with. Can you
Yeah, I
tell us
did.
what that is?
Okay. So firstly, I'm still a beneficiary under the Life for a Child. So Zimbabwe Diabetes Association signed an MOU, Memorandum of Understanding, with Life for a Child, which they provide insulin for people that are 25 years and below. So all those people, they get insulin, they get glucometers, they get syringes to use, but only they get human insulin like Isofen, Atropid, but not those new developments, not those new insulin that are being prescribed for people to use right these days. So it's sort of like a disadvantage to the people. because we do not have updated statistics. I mean, I think this is just because of weak association that we have in Africa, where they can't have updated information, enough statistics to say how many people are living with diabetes. But of course, the guys, they really want to help. They just want to offer help. So they say, if you want us to give you ABC, just give us the numbers of what you want so that we can help you. So, but because of the situation that we have, only people, a few people that have been helped, like from 10 years ago, are the people that are still being helped by this this initiative. And I think in the next 2 months, we'll be receiving another batch where people are going to be helped, giving insulin and stuff like that. So it's just a few people from 25 years and below only. But otherwise, since we have been faced with some disruptions due to the COVID-19 and other restrictions that are beyond our control, people have been had to resort to their own pocket to buy insulin on their own, because Life for a Child was not giving anything, and that's what we were told. So it was sort of like a challenge, really.
Okay, so the Life for a Child then is a charity, but did you tell me then the government has a scheme for insulin, to supply insulin for children? Is that right?
No, Zimbabwe doesn't have a scheme as of yet. Like only what they do, our government only provides medication for people that are living with HIV and AIDS. Of course, we get donations from abroad, and they also fund from our own taxes. Like every individual who works, every employee contributes to the tax fund, which is what we're advocating for right now. We're advocating that if that AIDS levy can be transformed to say health fund, maybe to help other people that are being impacted by the condition that they're living with NCDs. So the scheme only serves for the people that are living with HIV and AIDS.
Okay, yeah, I mean, I think you and Sarah told me the fact that every child in every school knows about HIV, but very, very, very few people know or understand about diabetes. Is that right?
Yes.
Yeah. Yes.
And
Yeah.
so I've asked,
Wow. Oh yeah, sure thing.
Sarah, you're talking about them making information about diabetes better known in Uganda. Is that an area you're working in?
Yes, so I work with, I volunteer with a patient organization called Africa Diabetes Alliance. And one of the main focuses, we focus on diabetes education, because we realized from our own experiences and other people's experiences, there's little information out there for people living with diabetes. You have to go out of your way to find this information. So we provide diabetes education, free diabetes education, nutrition advice, peer support to people living with diabetes that helps them manage the diabetes better. And we've seen great change. Personally, I have seen great improvement in my own management and other people that we've been able to offer those services to free of charge. There's been an improvement, knowing what you're dealing with, what to do, when you need to do it. You know, it helps relieve that burden of, I am alone, what should I do about this disease? So yeah, we try to reach out to as many diabetics as we can.
Okay, and I mean, to Tino and Sarah then, is there a stigma attached to having diabetes in Uganda and Zimbabwe? Would there be a stigma attached where people might look down on you?
In Uganda, there's a lot of misinformation about diabetes when it comes to diabetes. So it's that misinformation that causes most of the stigmatization and discrimination. You know, people think diabetes is in Uganda, diabetes is attached to wealth. You know, that's a rich person's disease. It's not that serious. You know, those are rich people problems. You know, they don't realize the seriousness of diabetes. You know, because it's put under that category of, you know, they just cause them on caused it on themselves. And then there's a lot of myth about diabetes, or you can cure it if you drink more natural remedies, or if you take more herbs, or if you try this or you try that. There's a lot of that misinformation that diabetes can go away if someone just eats right, or takes, natural herbs, Ugandan herbs. So when you talk about people like, but you're not taking good care of yourself, because if you tried this and you tried that, you wouldn't have diabetes anymore. So there's still a lot of misinformation that leads to the discrimination at the end of the day, because people think you're just not doing enough to get rid of this disease that can just go away. I have friends that still ask me, did you eventually outgrow your diabetes? Because they think it's something you can outgrow as you grow older. So there's a lot of misinformation.
Okay, I'm gonna, Edith,
Okay.
it's fantastic to see Edith, so I'm gonna ask Edith to come in a wee minute. That's the time, it's the warning you've got, Edith. Tino, what about the stigma in Zimbabwe then for diabetes? What have you found?
Oh, okay. So like I would say, okay, in my case, of course, I think I've had diabetes since I was in primary school to high school up until now. I'm in the university. So of course, I would say that 70% we do not have such cases. But where do I get to hear about discrimination? I hear it from other people, from friends. Like discrimination, maybe starting from their families, which are too judgmental when their children, or when the people that are living with diabetes in a family, when they are not managing their blood sugars well, maybe they think because of what he or she has ate, that's why she's having so much high blood sugar levels, not knowing that there are other factors that contributes to those regimens, those blood sugar levels and stuff like that. But the major problem that we have right now in Africa, or should I say Zimbabwe, is misinformation, where people are coming in as if they want to help people. They're offering to herbs, they're offering products that they are claiming that they can cure diabetes. So many people that have used such remedies from people that do not have information about them, they don't even really know what diabetes really is. So those people, they've been taken to the hospital, got into DKA because they started to neglect to take their dosages. Maybe what they've been given could cure their diabetes, not knowing that it cannot be cured yet. But then, of course, that is the problem that we have. Really much what it is, they just say, okay, fine, you have to just share with us. So my friends, in my scope of learning, or the people that I interact with,
Tino,
they're so
we're
keen
losing you again,
to
Tino.
learn more, and we've been just doing it. So, and they empower me, doing well. We're seeing the lot that you're doing. So, hello, sorry.
I said we're losing you again, Tino. You're coming in and out. Listen, I'm going to come back in a minute, and I'm going to give you 1 minute to say what your hopes are for Zimbabwe and diabetes. So we'll come back to you. Sarah, I'm going to give you the same time, 1 minute to say. Edith, are you there?
Yes, I'm here, Alistair.
All right, okay. Lovely to see a photograph of you.
Yeah, you too.
So, Edith, can you tell people then what is your role in the African Diabetes Alliance, please?
What is my role? Well, I'm one of the co-founders of Africa Diabetes Alliance. The other co-founder is Carol. Unfortunately, she cannot be here tonight. Carol lives in the UK as well, and she works with University of Leeds. She's a researcher, and we're working on a grant to do some research in nutrition and diabetes. And yeah, we have quite an amazing team that we're working with, hopefully to create solutions for people in education and all that. Sarah gave a very good description of what ADA is about, and give her kudos for that one. But right now, because we are looking for solutions, because a lot of the time you'll find that yes, you can educate people, but rarely can they actually practice that advice that you give them. So they need tools, they need solutions. I once met one time I was doing a class with an older gentleman, and he had just retired from work, and he had type 2 diabetes, and I told him, well, you should eat like this and do like that, and he says, I don't have access to all of that kind of food, especially now that I'm retired. The only food I can have is maize meal and beans every single day, and that's it. So you're telling him to have vegetables, and he can't afford that, you know. So right now we're looking for ways to offer solutions to some of these challenges. Can someone, for example, have a vegetable garden behind their house or in their compound that could help them access more vegetables to help with their nutrition, to help with their blood sugar management? So we're right now in the process of really finding solutions to some of these challenges. But for young people especially, because, you know, young people have as in we all have a lot of potential, but when your diabetes is not well managed, your potential disappears in the shortest time possible, you know. For example, when I was in school, I was at the top of my class, and when I was diagnosed, I suddenly, because I was diagnosed and then I was put on metformin, which is an oral drug for type 2, and my blood sugar was never okay. So I had so many challenges in school. I didn't access insulin until 3 years after my initial diagnosis. And even then it was too expensive. So even at university, I could barely attend class because I'd lost all the weight on my body. I was literally just skin and bones. And yeah, so going through all that hardship taught me that, you know what, because back in the day when I'd be suffering, I'd say, why isn't there an organization that helps people like me? So when I reached a point where, okay, now you're doing better, you can take care of you, can you find a way to help other people, you know? And it's really been an amazing journey, just really helping people and learning more and trying to use all that new knowledge and teach others. It's been quite an interesting journey. So yeah, I think that's a little bit about the story of how ADA started.
Okay, Edith, that's fantastic. Thank you very much for coming in there. Wendy, I'm going to go to you and just have a very quick chat. So the last year hasn't been an easy year for you, has it?
No, I had COVID in October. Thought I got off quite lightly and didn't have a temperature the whole time, had an awful headache and was really, really fatigued. But come day 9 after diagnosis, I thought, oh, this is wonderful. I've got off much, much, much easier than I thought, and woke up the next day and could hardly breathe. It was like that. Couldn't move, couldn't get out of bed, phoned the doctor. My husband had to speak to them because I couldn't speak. I was so breathless, and ended up in hospital. The doctor immediately sent me to hospital. Then following my release from hospital, I lost my taste of sense and smell in early October last year, and it's still not back. And for somebody that loves to cook and eat, it's not a happy place to be. So headaches I'm still getting. Tiredness isn't as bad, but I'm still getting. I then in October, November and December of last year just felt, from being that positive, upbeat person that I am 99% of the time, I really took a big hit. I really took a big, just like I can't even explain it. For me, it was like a real kick in the teeth, because it's not me. I don't look on the dark side of anything, but I could only see darkness. It was horrible, a horrible place to be. But I bottled that all up inside me because I had 2 children home from university because of COVID. I have a husband in the house. I thought, I can't let people think that I'm weak and I'm not coping. And it took a lot for me to admit to myself that I'm not coping, and to go and just admit that to people and talk to people and have a bit of a chat about it and come out the other side. And when I hear from you folk in Uganda and that, I'm flabbergasted. It's not often I'm speechless, but I really would love to be able to help, because it's horrific that happens, and I'm sure it happens. We don't take what the NHS does for us with enough credence, really, and because I never think about where my insulin comes from. I know it's there. I never think about my glucose strips. I never think about all the help that I have, echo aside, none of which I pay for, none of which it's even questioned by my doctor ever how much I need of it. It's really meant something to me that tonight. But when it was suggested to me by I've forgotten her name. That's another side effect of COVID. My short-term memory is shot. It might just be my age, but I'm blaming COVID. I can't remember names of people. The girl from Diabetes UK Northern Ireland who contacted me, or how I found out about your little group, Alistair. I can't even remember how I found out about it. Who was it?
Was it Heather or Olivia?
Possibly. I'm not going to say yes because I don't remember their name. And I didn't really, it was a wee trial group for 6 weeks, that little peer advocate sort of group. I got involved in that, and it did, I don't know what it did to me. And I don't ever remember really opening up to you all and really having heartfelt discussions, but I came out the other end of that like with a breath of fresh air, and it really helped me. And I've said that to lots and lots of people, how much that I felt it helped me, even though at the time I could have come away from those meetings on whatever the nights we had them and your lovely quizzes, and it just brightened up a night, and that carried me through till the next week. It really did help. But yeah, it's been a hard year. The loss of my diabetes control over the last couple of weeks per echo hasn't had a minute's rest. My sugars have been at 23 1 minute and 3 the next. That's the thing I find hard to cope with, that I manage it in the same way and I do everything like I always did, and it has a life of its own. Yeah. I find that really hard because I am used to, my job is things obey rules, and if you go outside the rules, then that just doesn't work. I bring you back into line. That's not happening with my diabetes, and that's what I find hard to deal with at times.
Wendy, listen, we'll talk to Tina and Sarah in a minute there, but your story's been inspirational as well, and if people haven't been following the chat and the chat box down the side, take a minute to look at it. There's questions in there about Sarah. Where's your blog so people can actually get onto that there and see what's going on. There's information in there for Ola then from Nigeria about his experiences there. If you haven't read the chat, go down and read the chat. It's fantastic there just to go down through it. Oh yeah, tokenism, more activism. I think we do lots of talking, so we are good. It sounds so good. Tino, I was going to give you 2 minutes. I'll give you 1 minute, Tino, to say what your hopes are for the next year, 5 years in Zimbabwe and diabetes. Is Tino still there?
Oh, thank you. Yeah, I am. Thank you for, okay. So I just hope that I'm not going to be kicked out by the network. Anyway, my hopes for the next 5 years is a world where every NCD is considered as a health threat. This is my biggest hope, and to see where insulin for all becomes a reality, which is even the World Health Organization is giving its all, trying to contribute to make sure that this becomes a reality. And of course, by then, by 5 years, I'll be a graduate. So I want to be a successful fraud examiner who remains steadfast in disarming diabetes, giving my all to those that are in need without any favoritism, just giving my all and remain there to support, to encourage people, and to give hope, to restore to people that have lost hope. So yeah, this is my hopes for the future.
That's fantastic, Tino. Thank you. Sarah, you're going to have the last word here. I'm going to go over to Uganda. And Sarah, if you unmute, remember to unmute, Sarah. Can you say what your hopes are for the next year, next 5 years?
My hopes to have total accessibility to diabetes medical supplies in Uganda, for every diabetic to be able to access these medical supplies free of charge, you know, from test strips to insulin to everything. I hope we get to that point where you just walk into a health center and you actually get all these supplies free of charge. I also hope we get to a point where, as patients living with diabetes, we get to choose which supplies we can, you know, we can talk to the doctors and choose, because right now you basically go with what the doctor gives you, what's available on the market. We don't have so many choices when it comes to insulin. We have like 3 or 2 types, you know, in Uganda that other countries have moved on from. So I hope in the next 5 years, you know, we can have access to those medical supplies as well. I also hope all diabetics can have all this information availed to them free of charge whenever they want to. You know, we can read about it, we can take care of ourselves better with this information. And, you know, mainly I hope the government thinks about people living with diabetes and takes it serious, you know, and that burden of expenses is lifted off all of us.
Okay, that is fantastic. Listen, can I just thank everybody for coming along tonight? I really, really appreciate it. I'm going to hand over to Albert to finish. Would you do something for me? Would you, could everybody on the count of 3 could switch your cameras on? I know it's going to run down your bandwidth. Let me get a photograph. So we'll switch
Echo.
cameras on, everybody.
Hold on till I get echo up.
All right.
Yeah, come here, quick, up here. No, not on the floor.
Oh, well, while you're preparing, could I say thank you very much for taking part tonight. Thank you for the contributions, which have been most informative and inspiring. And we would look forward to you joining us in a month's time. I'm not sure what the program will be at that particular time, but I say it's been good to see you, and thank you for taking part. Could I just ask that Heather, Nikki, and Alistair remain online when everybody else goes home or switches off, perhaps? They are at home. Thank you.
Okay, so ready, 1, 2, everybody smile, okay? So see, in Uganda, I mean, over here we'd say cheese whenever you're getting photograph taken. Well, what do they say in Uganda whenever you're getting a photograph taken?
You say fene.
You say what?
Fene. That's jackfruit.
Sorry, just one further thing. Alistair has been recording this session, so it would be available to anybody that wanted. If you make contact with Alistair, you'll be able to get a replay.
Oh.
Yeah, well, only bits of it actually. Usually I just forgot. So there we go. I haven't had COVID, thankfully. Ready, we're going to smile. Ready, 1, 2, 3, smile. Whatever that word was, we've just said it inside. So thank you very much. All right.
Thank you.
Thank you very much for listening.
Vivian.
Thank you.
Thank you.
Thank you, Mr. Alastair.
Thank you,
Thank you,
everybody.
everybody.
Bye.
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 Thank you. Thanks, everyone.
Thank
Bye.
everybody. Very interesting night. Enjoyed it.
Vivian, okay. Tino, you away? Tino. I'm following.
Yeah, I'm still here. I'm still here.
Are you still there?
Yes, I am.
Yes.
Andy, listen, thank you very, very much. Really, really appreciate you taking the time. I mean, that was a very powerful story you had to tell there. So thank you.
That really was good. Thank you.
Thank you,
Oh,
everyone.
welcome. Thank
Bye.
you. Thank you for having us.
Bye. Have a
So,
lovely night.
apologies for the network. That was always disturbing, but yeah, it was great. It was great.
That was great.
Thank you. Thank you so much.
We had
Thank you,
most
Mr.
of it,
Alastair.
Tino.
Really? Okay, that's cool. Thank you.
Bye. All right, goodbye. Thank you.
Ola, how are you?
Yeah, I'm fine. I'm good.
Good. Sure.
Thank you.
We'll talk tomorrow, Ola. All right.
All right. Yeah. Thank you very much. I actually slept off. I'm sorry. But I woke up and I had to rush to get my phone. I'm very sorry for coming late. Thank you for the meeting. I really appreciate it.
That's okay, Ola. Ola, I mean, your bride didn't come in there. I'm not quite sure. I'll try and find out why she didn't come. All right.
Oh, it's not a problem. It's not a problem. Really, I'm actually glad to be here again
Great, Ola.
to participate in this meeting. I'm actually glad. Thank you for checking on me. I really appreciate it.
No problem.
Thank you very much.
Bye.
All right.
Bye.
All right. I have to go now. Bye.
Yeah, bye.
All right. Peace.
And then they were.
Yeah, it's like
Got your picture back, Heather.
my internet's so bad it must have kicked me out like 6 times. I don't know what's going on.